What you didn't know about typhoid fever. This is perhaps the most popular ailment in Nigeria. It is often used by people to refer to any case of fever and general tiredness. If typhoid was and are then spread to other people in the area. India, Pakistan, and Egypt are also known as high-risk areas for developing this disease. Worldwide, typhoid fever affects more than 21 million people annually, and about 200,000 people die from the disease. How do people get typhoid fever? Typhoid fever is contracted by drinking or eating the bacteria in contaminated food or water. People with acute illness can contaminate the surrounding water supply through stool, which contains a high concentration of the bacteria. Contamination of the water supply can in turn taint the food supply, the bloodstream temporarily. The bacteria are carried by white blood cells in the liver, spleen, and bone marrow, where they multiply and re-enter the bloodstream. People develop symptoms, including fever at this point. Bacteria invade the gallbladder, biliary system, and the lymphatic tissue of the bowel. Here, they multiply in high numbers. The bacteria then pass into the intestinal tract and can be identified in stool samples. If a test result isn't clear, blood or urine samples will be taken to make a diagnosis. What are the signs and symptoms of typhoid and paratyphoid fevers? Typhoid and paratyphoid fevers have similar symptoms. People usually have a sustained fever, one that doesn't come and go, that can be as high as 103 to 104 degrees Fahrenheit, 30 to 40 degrees Celsius. Other symptoms of typhoid fever and paratyphoid fever include weakness, stomach pain, headache, diarrhea or constipation, cough, loss of appetite. Some people with typhoid or paratyphoid fever develop a rash of flat rose-colored spots. What do you do if you think you have typhoid or paratyphoid fever? The only way to know for sure if an illness is typhoid or paratyphoid fever is to have a sample of blood or stool tested for Salmonella Typhi or Salmonella paratyphi. If you have a fever and feel very ill, see a doctor immediately. How are typhoid and paratyphoid fevers treated? Typhoid and paratyphoid fevers are treated with antibiotics. Resistance to antibiotics is increasing in the bacteria that cause these diseases. When bacteria are resistant to antibiotics, the bacteria are not killed and their growth is not stopped when the antibiotics are taken. Your doctor may order special tests to see if the bacteria causing your infection are resistant. Results from those tests may affect what antibiotic treatment you may receive. People who do not get appropriate antibiotic treatments may have fever for weeks or months, or may even develop complications. People who do not get treatment can die from complications of the infection. The danger from typhoid fever or paratyphoid fever doesn't end when symptoms disappear. Even if your symptoms seem to go away, you may still be carrying Salmonella Typhi or Salmonella paratyphi. If so, the illness could return, or you could pass the bacteria to other people. In fact, if you are a health worker or work at a job where you handle food or care for small children, you may not be able to return to work until a doctor has determined you no longer carry the bacteria. If you are being treated for typhoid fever or paratyphoid fever, it is important to do the following to lower the chance that you will pass the bacteria onto someone else. Keep taking antibiotics for as long as the doctor has recommended. Wash your hands carefully with soap and water after using the bathroom, and do not prepare or serve food for other people.